What is a vasectomy? A vasectomy is a medical procedure where a man won't be able to father any more children into the future. It takes about 15 to 20 minutes and is done under local anaesthetic. A doctor will make a small incision into the scrotal sac and then be able to bring up the tube that carries sperm right up to the surface and cut that tube. That tube's called the vas deferens. The vas deferens tubes are very good at healing back together. If you simply cut the tube, about 1 in 200 will actually rejoin together, which is too high. So at Queensland Vasectomy, we do 3 steps, each individually, to help reduce the risk of the tubes healing back together. So the tube is cut, the top part of the tube is sealed off, and then a layer of tissue is folded between the 2 tips of the vas deferens, which acts as a barrier to also help stop it rejoin. It's important to note you'll still have sperm in the top part of the tube that needs to empty out. So it's important to still use condoms or some other form of contraception until you get the all clear from a test. This is usually at 3 months. A vasectomy does come with some small risks. These include infection, bleeding, small lumps inside the scrotum, or an ongoing dull ache. These risks are incredibly rare, but they do happen. Everything we do at Queensland Vasectomy tries to minimise the risk of this happening to men. The risks of not having a vasectomy are an unplanned or unintended pregnancy, or the risks that come along with other forms of contraception, such as the pill, or a Mirena, or a tubal ligation. They're risks that you should probably talk to your GP about and try to come to a decision that works best for you and your partner. The advantages of a vasectomy are its cost effectiveness in the long run and its effectiveness at preventing unintended pregnancies. So a vasectomy is pretty much the most reliable way to stop an unplanned pregnancy. At Queensland Vasectomy, we do everything we can to try and minimise the risk for each individual man, even though the risks of these complications are small to begin with.